Today I would like to speak about a young lady who had come to me with infection in the abdominal wall. She had got this infection following a cesarean section which was done about 6 months back, but she was having this infection off and on examining and doing a ultrasound examination, we found that she had multiple discharging sinus tracts in the lower abdomen, which were starting from the site of the cesarean section, and this was giving her a lot of inconvenience. So after explaining to her, we had done a surgery and excised all the sinus tracts. What I would like to emphasize in this video is that sterilization in the preoperative period, the sterilization of the instruments, the sterilization of the operation theater, it's a very important thing and needs to be looked into. Otherwise, this kind of infections can occur in all the patients undergoing this kind of surgery.
মোৰ আসলতে 11 মান্থছৰ বেবি আছে, তেতিয়া মানে অলপ wound infection হৈছিল আৰু ৰাইট এবডোমেন পাৰ্টত অলপ মাল্টিপল সাইনাস ট্ৰেক ইনফেকশন পাইছিল। ডক্টৰ কৌশিক বৰুৱাৰ আন্ডাৰত মোৰ ট্ৰিটমেন্ট চলি আছিল। তেখেতে টেষ্টবিলাক দিলে, টেষ্টবিলাকত যেতিয়া ধৰা পৰিলে যে মোৰ সাইনাস ট্ৰেক ইনফেকশন হৈছে, সেইকাৰণে তেখেতে অপাৰেশ্যন কৰিব লাগিব বুলি ক'লে আৰু আমি ঠিক তেনেকে অপাৰেশ্যন কৰিবলৈ বুলি শুকুৰবাৰে ফ্ৰাইডে এডমিট হৈছো।
Sterilization is a specialized mechanism by which we clean the instruments, because most of the instruments that we use in the surgical OT are all reusable. So the instruments have to be cleaned properly and they have to be sterilized either by autoclave or by methods like ETO sterilization, because if it's not properly done, then surgical site infections can occur just like in this lady, and the patient suffers a lot and takes a lot of time to recover. Most of the infections that we see nowadays are port site infections, which happens because of an organism called atypical mycobacterium. An atypical mycobacterium spreads from water source, which is used to clean the instruments, and if the instruments are not properly dried, if not properly sterilized, then these infections can enter the human body and be a big problem for the patients in the post-operative period.
এটা মোৰ ভালদৰে অপাৰেশ্যন হৈ গৈছে আৰু ইয়াত ডক্টৰো ভালদৰে আমাক চাইছে, ট্ৰিটমেন্ট কৰি আছে। ইয়াৰ যিমানখিনি ষ্টাফ হওক বা যিমানখিনি আমি সুবিধা মানে তেওঁলোকে যিমানখিনি আমি বিচাৰিছো সুবিধা তেনেকৈ আমাক সুবিধা কৰি দিছে। সেইকাৰণে এপলো এক্সেলকেয়াৰ সকলোকে ষ্টাফ এণ্ড অল সকলোকে ধন্যবাদ জনাইছোঁ আৰু ডক্টৰ কৌশিক বৰুৱা ছাৰলৈ বহুত ধন্যবাদ জনাইছোঁ।